Welcome back. And it's my pleasure to introduce the next session, which is how have EU presidencies driven the agenda for the European development of digital health and data, how in the future? So I'd like to introduce you to Tapani, who's had a distinguished career in public health sector. He's the former European Commission where he was head of unit for 14 years, having had a career in the Finnish Ministry of Social Affairs and Health. And he is a medical specialist by profession. So Tapani, over to you. Thank you.
Thank you, Vladin. We have a very interesting panel this afternoon. How the EU presidencies drive the agenda for the European development of digital health and data. But I understand that we have lots of audience from all corners of the world. So what on the earth is the EU presidency? So I would like to give you a few words about first, before we go into the panel. The presidency is part of the carefully balanced management of the policy making in the European Union. Most of you know the European Commission, which is the EU executive, which is making proposals and implementing the policies which have been agreed upon. But those policies, they are usually decided upon by the Council and the Parliament, and the Parliament is the third actor here. But now today we are speaking about the Council, where the member states come together. For example, in our area, the ministers of health are coming regularly together to discuss and decide on matters. And now we are trying to look at how this Council of Ministers will be setting the policy agenda. The presidency of the Council is the member state who is in charge of the Council meetings. Each member state in turn has this responsibility and duty. It's for 6 months. So it means that for 6 months you are basically, the member states driving the policy making in the Council, and the Council is the main policy setting tool for the member states. So it's very important for the member states as a tool. And therefore, all those the country who has the presidency is trying often to put its ideas on the EU policy agenda and drive them forward, while being this short half a year, an honest broker between all the 27 member states. And so this mechanism, the presidency, it has this kind of policy-making tool. And now the question is that what are we going to discuss in this panel? First of all, what is the role of presidencies in setting this agenda of the European Union? Secondly, how the member states can do a better job in aligning their priorities and supporting each other and work with the Commission while having the presidency. And then we have distinguished panelists who have been involved in the presidencies, and therefore we try to give the advice for the forthcoming presidencies, how to make a successful presidency. So we have 4 panelists here. I must first tell you that due to last-minute changes, we do have an all-male panel. That was not the intention, but it was a last-minute change. But we have very good people here today discussing with you. First of all, we have Nick Schneider. He is the head of division on new technologies and data use at the German Federal Ministry of Health. Nick, when did Germany have its presidency?
Thank you, Tapani. Hello, everyone. Well, we had our presidency autumn last year, so it's fairly recent.
Thank you. So that means that you still remember very well what happened. Our second panelist is Ponciano Oliveira, who is the member of the executive board of Shared Services of the Ministry of Health, which is, I think, better known as SPMS in Portugal. So when was your presidency, Ponciano?
Exactly. Thank you for the introduction, Mr. Tapani. Our presidency, we took over the presidency on January the 1st on 2021, following Germany, and then we handed it to Slovenia in the 30th of June. Thank you for the invitation, dear colleagues, dear audience, and to everybody who's listening.
Thank you. So that means that you are just recovering from the presidency. Then we have Aaviksoo, who is the Chief Medical Officer at Guardtime, a company on blockchain. But previously, you were the Undersecretary for E-Services and Innovation in Health Care in Estonia. When was your presidency? You are muted.
Sorry, thank you, Tapani. Indeed, 2017, second half was the presidency, the first time EU presidency Estonia held. And as the Chief Information Innovation Officer at that time for the Estonian government, I still do remember very vividly that great time.
Thank you. And the last panelist is Professor Martin Curley, who is the Director of Digital Transformation, Health Service Executive in Ireland. What is your situation?
Hello, Tapani. Our last presidency was 2013, and I actually remember it well, as Ain does. We were involved in the flagship thought leadership event for the presidency, which was about open innovation 2.0. But our next turn is in the second half of 2026, so we have a while to go.
Thank you.
Today. Thank you.
And indeed, me myself, I was heading the health working group during the first ever Finnish presidency in 1999, and then I was assisting the ministry back in Finland in 2019. So that's our background, and let's go to study a little bit what happened during these presidencies. And I have a question to each panelist, and which covers a specific aspect of the presidency, but also you can say a few words about your presidency in general. And I would like to start with you, Nick. The German presidency was a successful one. Do you think that the presidency managed to set the agenda during the presidency and beyond? Over to you.
Thank you, Tapani. Success is rather relative. And not on me to judge if our presidency 1 year afterwards was already a success or not. I think our mantra during the presidency was paving the way for the European health data space. And we indeed managed to create momentum for the European health data space, which before the German presidency was not even on the agenda, was a term which was mainly an acronym which needed explanation for everyone. And nowadays, I think we managed to create some awareness about what could be the European health data space. But we're still very early on that journey. I hope that the journey will be finalized before the Irish presidency in 2026, but we are still on the way. In a certain way, our endeavor is merely one pillar of a bridge which is still under construction. And that's how I see the work of the member states, rather as a bridge towards one common aim we wish to reach. And we have, besides the trio presidencies, where we work very closely with our colleagues from Portugal and Slovenia, we have those regular pillars on digital health, which help paving that way. And I see one of the starting pillars has been the Estonian presidency, then followed by the Finnish one. And when we started, we built on those experiences and suggestions. We built on what has been established already by our predecessors. And we could rely on an extensive and good collaboration with the other member states, especially those involved in digital health already, and the European Commission, which was also very dedicated to really work on the health data space. So I think that was something where we were quite fortunate, and we also felt humbled because this is not really a stronghold of Germany. I think when we started to talk about secondary use of health data, everybody was a bit surprised why Germany. Germany is a laggard when it comes to digitalization. I think that's something which we could use also to bring the debate on national level. And I think this give and take has been what I consider a success, because we learned a lot from our European partners, because we brought them to our country. And what we did, and I think that's also part of the maybe success story, that we had the opportunity to organize a series of workshops well in advance of our presidency on secondary use of health data, to really bring stakeholders together, bring member states together, bring Commission and European Union institutions together to debate what challenges are we seeing in access to health data and what possible solutions might be out there. I think the sequence of workshops on very practical level to discuss issues, then having a high-level conference during the presidency and council conclusions with digital health at one of the aspects under lessons learned from COVID-19 was actually what helped creating that momentum and creating awareness for the EHDS. So I think we have to look at this whole concept. I think the thing is to have one streamlined message from the very beginning, not to lose too many loose ends, but just having one key message and know where you want to go. And just say, well, we have this one pillar and we want to bring things forward collaboratively in Europe. And I think that's something which for us was helpful. And it was not having a big member state like Germany telling everyone what to do and what works there. I think that's something which would not have been helpful. I think this approach, learning from others, was kind of what was helpful for us.
Your presidency was also one of those presidencies which were hit by the COVID. And how would you say that the presidency managed to drive the business during the COVID time?
Well, I think we all had similar challenges during the COVID times, and it was difficult for us because we were expecting a normal presidency with a lot of trips to Brussels, with a lot of debate in Brussels, discussion, and suddenly everything had to be done virtually. Everything had to be done by video conferencing. The usual working group meetings could not take place in Brussels anymore. So I think we had to adapt quite rapidly to a new situation which was not there before, and which also the treaty in itself and the whole European Union infrastructure did not foresee. And I think that meant that was actually, again, an endeavor which by the Council, the Commission, and even the Parliament was managed in a quite good format. And I think we managed their presidency to really come up with concrete suggestions and solutions. And I think we were also hearing from a colleague from Portugal that also things like the corona tracing apps were a European success story because we managed to actually overcome European borders throughout that last trio presidency, which was something we honestly didn't really expect before COVID-19, that we would move that fast when it comes to digital transformation in the member state, but also in the union.
Thank you. And I think that for us working in the digital, the transformation into digital mode of working was easier than for some other policy sectors. But let's go to Ain. There is now some time since the Estonian presidency. You said that you still remember it vividly, but maybe you can tell us a little bit about the Estonian presidency as well as what were the best and the lasting successes of your presidency in digital health.
Yeah, thank you. I believe every country wants to promote and the best ideas and policies according to their own understanding. And in principle, I'd really like to say everyone that these possibilities are endless in principle, even in this complex maze of EU decision making. But they are constrained in the moment of time that you happen to be. So this principle has guided me myself throughout the different roles that I have. Chief Medical Officer of a global cybersecurity company, or Undersecretary for the Ministry, or a mental health startup founder. Estonia started its presidency 6 months earlier than initially planned due to the decision by UK citizens to leave EU, which meant that we even had less time to prepare for that. There weren't any big dossiers on table. So we literally, stand in front of a whiteboard and started to think what is it that we can achieve within 6 months, but also that would have some legacy afterwards. And we did realize that in order to do so, we need to have other stakeholders outside of this administrations to work with us, or also us working with them. Maybe the ignorance in this time was blessing that we actually thought that innovation hubs, informal action-oriented government programs, as we call them, special interest groups, patient organizations, shortly doers, and not just the legacy institutions, was something that we draw on a whiteboard and then start to think what can we do and how can we do this. And then I'm also thankful to some very good friends and bold people. Brian O'Connor, Bledin, honored and humbled that the Digital Health Society is a result of bold brainstorming. Okay, what can we do as a presidency, and what are the partners that we can bring along? Then we had the previous presidency, Maltese presidency. Once again, thank you, Chris Fern, and your team at that time, President Minister, who allowed to bring this idea at the last meeting held by Maltese presidency. It was really a kind of startup-like idea. We had a small room. We anticipated 20 people to join, and then the room was crammed. We couldn't find more chairs. There wasn't COVID at that time, so we didn't have to spread out people. So yes, and we started with an idea, and then we started to look for what are the tools available. So that I do think that EU has tools for every idea that you have. And it is about member states, having be or Cyprus or Estonia with the same size for 6 months as, for instance, Germany or France. And it is possible to start implementing. And then Council conclusions came as a practical tool, so that we would have something on paper, which I have learned over time that decisions on paper with signatures are important for sustainability. And then also, when I look back, I noticed that starting from the Swedish presidency in 2009, when the Council conclusions first time said that in EU, in digital health domain, member states should and can do something. eHealth network was already established in 2011. And now, as we heard from Nick, actually you make those steps, you bring your own ideas, and I'm happy right now to see, and also to be in a different role, participant in a truly pan-European digital service, which was set up within basically 6 months, which is the EU COVID certificate solution. Now countries beyond European borders are using the same infrastructure. So yes, I think that presidencies can do things. They have to accommodate themselves to the times, and working together is the only way how you can sustain your legacy together in terms of with other member states, but also in terms of different stakeholders.
Thank you. You mentioned that Estonia is a small country, and of course that's very true, that one of the smallest countries. How do you think how can a small country do the presidency? How do the countries have the respect of the other member states? How does it work?
I am really, I can honestly say that at least within the professionals that I have been working, the respect to merit and good ideas is valued highly. Also, of course, I think Nick mentioned that already. You have to be focused. You have to be recognized. You have to recognize that you may have the best idea, you may have the best people in a small country, but in order to accomplish something, it takes time over years, which also means that you need to be able to accommodate. You need to understand what others would gain from your idea, and then working through basically this type of collaboration with a very clear focus. Even small countries can accomplish remarkable things, and I'm genuine. That's the beauty about being an EU citizen.
Thank you. We have a comment from the audience saying that thank you, Ain, for mentioning the mental health. And it's such an important part of global health and digital health. And it is a reminder for the audience that you can send questions, and we may have a possibility to answer 1 or 2 questions. So please send your questions. But while you are thinking about your questions, I would like to ask Ponciano to reflect on the Portuguese presidency. Where do you think that the Portuguese presidency made its mark? Over to you, Ponciano.
Well, thank you, Tapani. Well, for starting, we must know, and you must know for sure, that our presidency was marked by a difficult crisis, the pandemic crisis, and its social and economic consequences, posing unprecedented challenges to the EU and the member states. And therefore, we strive to push forward some instruments that could be decisive and involve a comprehensive, active way to respond and to improve and deliver EU common instruments to strengthen the national pandemic preparedness and response assets. To name a few of those instruments in a general way, in a general overview, the approval and entering into force of the Recovery and Resilience Facility is one of them. The adoption of the EU for Health 2021 and 2027, which was the largest health program for the sector, is another one. But as Nick Schneider was saying a while ago, the EU digital COVID certificate at the approval of the regulation at the political and the technical level was another example. So in that matter, this whole package stood quite well the mark of the Portuguese presidency. Nevertheless, we in the digital overview, in the digital health overview, we also made our mark. And for starting, as we already had this legal framework that was brought together by the German presidency, and before them the Finnish and the Estonian ones, bringing these topics of the digital health through outputs of their presidencies. We took over it and we maintained our efforts on that field, but in a more related field, in a more operative field. And we took away and we pushed a proof of concept in order to have a cross-border telehealth proof of concept without barriers that we managed to put it together in our 6 months presidency. This proof of concept aimed at testing the technical feasibility and added value of this type of cross services for citizens and public health affairs. So we took it in 3 different scenarios with the Swedish, with the Spain and Ireland, managing to put it together with planned care and unplanned care. In that way, we thought it would be very interesting, and we managed to show how it could be done after having this legal framework that was brought together by the former presidencies. We also had two workshops to support the dissemination and the raise of awareness over the health community. 2 workshops were held in March and May. The first one focused on assessing the state of the art of cross-border telehealth, and the last consisted of a working session on how to overcome the existing barriers. And that was very important because it meant with that experience, we could also develop a non-paper on cross-border telehealth services in the EU, a step forward to remove the existing barriers to cross-border telehealth in the EU, which details the development of the whole process of the proof of concept and its associated activities. Well, I think that the Portuguese presidency strives to bring telehealth and cross-border telehealth forward during its 6 months agenda, so as to make the most out of the lessons learned and the opportunity exposed by the pandemic. You are mute.
Yeah, I think that I also would like to congratulate the Portuguese presidency for this idea of the proof of concept. It was unique. I hadn't heard of it before, and I think you nicely highlighted the different things in the toolbox of the presidency, like the workshops and non-papers, and so there are a variety of things that can be done by the presidency. I think that I have a very quick question. If I can have a very short answer from you, that in your life, you have also been leading a major region of healthcare in Portugal. Do you think that this kind of a cross-border healthcare can take off in the European Union?
Yes, I can. Yes, I think. Actually, I've been working in the northern region for some years, and one of the main goals that we had on cross-border healthcare was the zone, the frontier, the migration population between the frontiers. And with the COVID crisis, it was very evident that this kind of crisis and the epidemic surveillance are very attached to the economic and the social life of those people. So I really think that, especially in the Central Europe, but not only on Central Europe, these instruments of telehealth will be very useful, especially in a context of high mobility and especially associated with artificial intelligence and electronic health records. It will be a very important tool to establish the continuity of care on those regions, on those border regions.
Thank you. And I can tell you that we had a meeting on Monday of the Finnish Ministry of Health, and we were discussing the EU policies in the future. And one of the things I highlighted that this cross-border healthcare or cross-border health telemedicine across borders will be one of the important topics. But then let's turn to the Irish presidency. It was some time ago, and the next one is sometime in the future. How do you think that the Irish presidencies come together? Can you bridge over such a long time?
Great. Well, thanks, Tapani, and thanks. Really good discussion so far. So I want to cover a couple of different aspects, but first to say that we recognize that Ireland is a digital health laggard. And to me, and increasingly to Ireland, it's increasingly clear that digitalization, is the central fix, or is the best prescription for our sick health system. So by the time Ireland has its next presidency in 2026, our goal is that Ireland will leap from being a laggard in Europe to one of the 2 or 3 digital health leaders. And we plan to do that via very disruptive digital technology adoption. So I'm hopeful in 2026, what we will be talking about is a success story and talking about the broad adoption of digital technologies and having design patterns and solutions that can be exported elsewhere. If I look back on the presidencies, I think there's a couple that stand out actually. So 2006, the Finnish presidency, Tapani, that you were, and the first announcement of the European Network of Living Labs in Espoo, I think was absolutely, fundamental. And sometimes it takes, you've heard the expression, on average, overnight success takes about 10 years. And it's taken about 10 years for that idea to become embedded. I would have to give enormous credit to the Cypriot presidency of 2012 and the whole Innova project that was spawned from that talked about towards a sustainable open health, open innovation health ecosystem across Europe. And the Cypriots were very forward-thinking in terms of talking about nutrition-based medicine and exercise-based medicine and open innovation. In Ireland in 2013, we tried to build on the Cypriot presidency by running the thought leadership event of the Irish presidency, which was called Open Innovation 2.0. And this is a new digital innovation paradigm. And I think Nick mentioned this, and you have to have a shared purpose and a shared goal. But when you can align all of the ecosystem and the quadruple helix, government, industry, academia, and citizens and patients around a common goal, this is actually when you start to make progress. So the Irish presidency, we had a key priority around a systematic methodology for innovating together. And in that, there are design patterns around using platforms, around using agile development, about industrializing the innovation process, about designing for adoption, about data-driven innovation. So what we're doing now in Ireland, hopefully we're walking the talk. It took us a while to get organized. We're actually using these principles in transforming our healthcare system. And what I don't think you can have leadership in health systems by committee or consensus. It's really hard to say have a I was looking back at some of the EU consultations, and I think the predecessor to EU for Health, there was 156 different submissions that had to be assimilated in some sort of coherent message, and that's really difficult. In Ireland, what we've tried to do is we have a policy called Sláinte Care, but we describe it in 4 words: stay left, shift left. And stay left is about keeping well people well, or if you happen to have a chronic condition, you can be managed best of all from home. And shift left is about moving patients as quickly as possible from acute to community to a home settings. And we're using this every single health decision that we're making. We're trying to ask, is this going to help us stay left, shift left? And we've adopted the quadruple aim. So every time we look at a digital intervention, we're seeing, does it improve care? Does it reduce cost? Does it improve quality of life? And lastly, does it improve the patient and clinician experience? And what we're finding with our digital solutions, that very often we're seeing a 10x impact. So we can do 10x the volume of patients for the same cost, or we can get 10x better outcomes at less cost. And I think, EU for Health is very admirable and it's an important program, but it kind of gets lost. You throw it out there, and what does it mean to the citizen? I think when John F. Kennedy said, I think it was in 1962, this decade we're going to put a man on the moon and bring him back safely. And he said, we do this not because it is easy, but precisely because it's hard. The American society, got behind that. And I think we need something of that ilk or vision that sort of transcends the presidency, so that European citizens realize this is probably the most important asset that we all have. We have to, work hard together. And, a number of years ago, Viviane Reding, who I can't remember which commission she was leading, she talked about adding 2 years of healthy life to every European citizen. I thought that was very noteworthy, but all of a sudden it got lost. So I think we need a little bit more coherency from the Commission on the health policy, just a shorter narrative. EU for Health is excellent, and there's 4 really good overarching priorities, but the citizens are as important as the politicians or as the companies. If we look at the social determinants of health, 40% of health outcomes actually come from nutrition and exercise, 30% come from genetics, 10% just come from clinical care, 15% come from environmental and other factors, and so on. And if I think about the American spending, 95% of the American health spending is in clinical care and just 5% in promotion. But that 5% is precisely where the highest leverage is. So I think the adoption of a stay left, shift left methodology where we're instrumented, and I want to commend sort of Nick and the German presidency, particularly for the outstanding work that they did on the DIGA process and digital therapeutics. Probably the single biggest thing that is associated, if we think about the clinical care, is medication adherence. And pharma companies will give 1 or 2 if they got a 1 or 2% increase in adherence, they pay millions and millions of dollars. But we've seen evidence, particularly with behavior change, that digital therapeutics can really change behaviors, increase adherence. So the Ministry of Health in Germany about 3 weeks ago hosted the Digital Medicine Conference, and as part of that there was a mini summit. And President Macron, I think, has displayed real leadership by ahead of that, saying that France will adopt the DIGA process. And in Berlin, we got about 9 countries signing up to say that we will adopt the German DIGA process. And I think now there's going to be some very direct prioritization in the French presidency around sort of a single European system for digital therapeutics, harmonization, regulation, and reimbursement.
I think that that's a good point to finish, and because that points clearly to what the French has to do. We have a few comments here from the audience. Donna Henderson is saying that the presidencies gain respect by setting realistic, achievable objectives that resonate with other regions, that attracts interest and engagement from others and a willingness to collaborate and engage with your agendas. And then I have a very short question to Nick, because I have been personally impressed that you all have very much emphasized the cooperation between the presidencies. But there's a specific question from Mariam Shokralla, who is wondering, is there any continuation or coordination mechanism between the presidencies? Over to you, Nick.
Thank you very much. Well, there are the trio presidencies. So every 3 presidencies together set a common agenda for 1.5 years. But I think what is still to be developed is the thematic overarching priority setting, as we have seen in digital health growing nationally through collaboration between the member states. The idea we just have with the bridge that we are collaboratively building now I think for 15 years, and we've taken a couple of years to build to really get the European health data space running. We hope to have it done by 2025, ideally, and we are hoping that the next presidency, especially the French now, which is very vocal on issues like health data, which built the health data hub in Paris and are very active in the field. I think there will be another leap forward, but I think that's up to the responsibility of the Commission and the member states to keep that momentum going. And but there is no structured dialogue yet on that long-term planning.
Maybe that is a task for the future EU presidencies to decide how this continuation can be better done. But now we are reaching the end of the panel. We have still time to give 1 minute advice for the future presidencies. And I would like to start with you, Ain, if you can give your advice in 1 minute for the future presidencies.
Yeah, thank you. So I've given a lot of thought that there needs to be good balance between policies and politics. So we've seen over the last 18, 20 months that if only politics drives decision-making, it can become messy. So there needs to be a moment when also experts and administrators can implement what has been agreed. But over the last 6 months, I've come to realize that in the digital health domain, I think there are a lot of good ideas, but there now needs some political, let's say, goal setting, which would help them to streamline all those independent activities into really concerted action. So I hope that this political leadership will shine at some point, and then we can all follow that great idea.
Thank you, Ain. And then I would like to turn to Ponciano. What is the advice from Portugal?
Well, our advice would be, first of all, to be prepared for a lot of work, of course, but then in a more serious way. Well, I think one of the main issues is to articulate with the other presidencies within the trio the 18 months agenda. For instance, as you can see, it worked very well with us in Germany and Slovenia, and we could have some theoretical work and some legal framework done, but then some practical consequences of it, and then we have Slovenia working on it also. So it's a way to have a consistent pathway of the public policies within the European Union. And finally, strive to raise awareness and push an area of your national interest forward. We advise you to establish an umbrella topic so to be included in the ongoing working of the Council. That would be our advice in order to have consequent European Union policies that in practice can be applied and can be translated into results for the citizen.
Thank you. And then I would like to give the word to Martin, and then Nikis then has the last word on this advice bit. Martin, over to you.
Right. I think to build on Ian's, I think there's 4 P's: politics, policy, practice, and persuasion. So I think based on the OECD report, Healthcare in the 21st Century, what's most important is there's a political decision that we go for digital health. So that's made at the highest level. Digital is the only disruptive sort of technology that's available, and it can transform. So then we need to translate that political decision into policy. And I think we totally have to disregard the idea of evidence-based policy making. I think that's such a sham. Like Steve Jobs never went and said, well, where's the evidence that the world needs an iPhone? So we have to actually go for this political and policy for digital health. Practice, we need to use living labs to move from proof of concept to demonstrators to broad adoption, where we're involving patients and clinicians in bringing digital health to reality. And then lastly, persuasion. We need to persuade citizens that they need to participate and take responsibility for their health. That paradigm is changing. It's no longer the doctor who knows best. The patient knows best. If you're an epileptic, a Parkinson's patient, you maybe get 1 or 2 hours clinical attention in the year, but the rest of the time you're actually on your own. So a move to network-centric healthcare, where the communities of different chronic diseases are working together to help help things improve. Second last point, Edison said 100 years ago, the doctor of the future will prescribe no medicines, but instead will instruct in nutrition and care of the skeletal frame. I think we need a massive shift in terms of actually medicine and teaching new doctors, new clinicians, all the other things that they're not taught in schools. And my last message will be stay left, shift left.
Thank you. And over to you, Nick.
Thank you, Tapani. I think yesterday when we talked, you said something, are council conclusions are nuisance, or do they work? And that's why I want to get back more to the policy level. And I think that's a very wise what all my colleagues just said. And I think for us as member states, as presidencies, I think we should make use of the instrument of the council conclusions to really set the agenda. And I think we have to know, I think for those out there which do not know the council conclusions, what are they? They are a document of consensus among the member states. They are actually some kind of a commitment letter. And I think that's something, when we collect the views of the stakeholders, of all those involved, the patients, the doctors, and we want to tell the Commission the how to do it, the what to do and the how to do. And I think that's how we should use a council conclusion, to really see it as a document which demonstrates where we want to go, which sets the agenda, which puts priorities out there, which guides research, which brings member states together to find a common solution. I think the joint action towards a European health data space, which is right now running under the leadership of our Finnish colleagues at Sitra, shows how actually concrete action by member states with the Commission can demonstrate the Commission how to do governance later on. And I think that's something which we should use. And we should not only use this to frame Europe, but also use Europe to frame our own systems, to learn from each other and bring that back. And I think this is a place where actually we can have a good political open debate. And I think we need to be open for that. But the Council conclusions always are a risk. They're not allowed to fail. We need consensus. So failing is not an option. So there we also have to be open. We don't have a silver bullet there. We need to be open for compromise. And you don't know when you enter with Council conclusions, the working group, if that's what you're proposing the group, the member states, will be that what is finally written in the Council conclusions, because the process over half a year to distillate the willingness and the commitment of all member states. I think that's also the beauty of it. And that makes Europe, as I said earlier, that makes the beauty of being a European citizen, also a European policymaker, that you're not sitting there as one member state alone, but you can jointly create the Europe we want. And I think that's something which, looking at the presidency, is something we need to always remember when we are the presidency, that we are actually framing the European Union and that we are further developing it towards a better union for our citizens. And yes, it's only policy at the beginning, and we need to add on the practical part. And that's actually what beautifully was said by Ponciano Oliveira just recently. Putting and adding disruptive new methods like a proof of concept. I think that's also something. Be innovative, start something new, and demonstrate that the presidency can go further. So yes, Council conclusions, but with new elements to innovate.
Thank you very much for this rich discussion. I think that we could have continued quite a lot longer, and there are lots of things I would have liked to comment myself. But I think that the one conclusion is that we came to a conclusion that the presidency has been a successful mechanism in balancing the policy initiatives between the member states and the Commission. And it is a perfect tool in engaging member states to work on the policies at EU level. And there are many tools the presidency has to at its disposal to make its mark. And one thing which has been highlighted over and over again in all your interventions is the cooperation between member states. You have made references to many other presidencies. So many thanks, dear panelists. Many thanks for this discussion. I hope that it was helpful for also the audience to understand better how the European Union presidencies work. Over to you, Bledin.
Thank you very much, Tapani. And on behalf of myself and the Digital Health Society, I'd like to thank you all, because this has been a really insightful session where you're providing knowledge that I think many of the audience will simply never have had an opportunity to listen to. And when Tapani and I first contemplated this, you've actually delivered in spades what I hoped we could achieve. And I'd like to thank Estonia, because without Estonia, there would be no Digital Health Society. And also Tapani, who has been a fantastic supporter of the Digital Health Society since we started. So I am grateful to you all, and thank you very much indeed. And we'll move on. Thank you.
Thank you.